everyone. Welcome to COVID Conversations with Bobby Newman and Bobby Rogers. They have partnered to shed a light on how COVID has affected our special needs population. Dr. Bobby Newman is a world-renowned psychologist and behavior analyst and author to many publications, books such as Move with a Purpose and Behavior Detectives. Bobby Rogers is a parent advocate, nonprofit founder, and director of Proud Moments Therapy in Syracuse, New York. Today, they will be interviewing Dr. Noor Syed. Dr. Syed is an assistant professor of applied behavior analysis, clinical coordinator, and founding director of the Center for Autism Inclusivity with the SUNY Empire State College. She is also an adjunct professor and PhD advisor for Endicott College. She works with the Anderson Center International and is affiliated with such organizations as the Global Autism Project and NISABA. Dr. Newman, why don't you begin?
Thank you. I do really love this series because it really allows me to work with my friends. And as I'm listening to you rattle off all of Noor's achievements, I'm like, yeah, go my friend. All right. I love hearing all this. We've known each other a good number of years, worked together, and continue to be together on professional boards. So it's always really nice to be able to highlight some of this and to get your thoughts on some of the things we've been talking about. One of the things that I know you've been doing a lot recently, following up on some of the work you had been doing with the Global Autism Project, and now I'm hearing all kinds of very exciting things about what's happening at the Anderson Center International. Can you fill in a little bit just what's been happening and just to kind of set that up? I know there were plans moving ahead pre-COVID, and now we've had to adjust vis-a-vis COVID in terms of quarantining and distance. And can you give us a little bit of a chronology of, what's been planned and what's actually happening?
Sure. Well, thank you all so much for having me. It is such a pleasure to be here. It's always so nice to work with friends. So thank you. It's my honor to be here. Bobby, I really appreciate you bringing up what's happening internationally. I think a lot of discussion has centered, as it should, domestically and what we've been doing within our insurance-based orgs and our schools, with COVID, and that's incredibly important. But I do appreciate you highlighting the international work because there continues to be a significant need internationally. And now we are finding ourselves in an unprecedented situation where our hands have been a bit more tied. So the Global Autism Project, and thank you for sharing their incredible work. We had been with the Global Autism Project traveling to partner organization sites for 2-week intensive trainings throughout the year. And at the Global Autism Project, we have partners in Indonesia, the Dominican Republic, to name 2 of the many countries that we are working with. But of course, that work and that travel had to pause when COVID happened. So right now, the project is focusing really intensively on, providing supports behind the scenes through clinical support, administrative support, as well as raising awareness through mediums like a podcast, so that people can have an understanding of what experiences are like for those who identify in different countries and live in areas where we are a little bit more under-resourced and don't have the educational materials that we might have for those who are listening in the United States that we have here. And so that's really exciting. Anderson Center International, where I'm super fortunate now to be kind of heading up their international program, was facing similar difficulties. So the Anderson Center International pre-COVID, we had been flying in fellows from around the world. And so some of those countries include Ethiopia, Ghana, India, again, just to name a few, to do really intensive on-site training here in the States with Anderson Center for Autism, where fellows are provided, room, board, stipends to learn about the incredible work and compassion, program development, all those important things when we're serving individuals who identify as neurodiverse. Certainly that work had to pause. Visas were a problem, flights were a problem, but I'm very excited to say that once the borders began opening up again, Anderson Center International jumped right back into the work. So we are now again a new group of fellows from around the world for intensive on-site training. And what we're doing from there is our plan is to create sustainable systems to help support the individuals that come here for intensive on-site training when they go back, to disseminate evidence-based strategies, and in many areas raise awareness and acceptance for individuals who identify with invisible and visible disabilities. We're also doing behavior analyst supervision right now, BACB. We know that changes in a few years, between us and the Czech and Slovak republics to pilot a curriculum that can actually be hopefully utilized around the world, because we still need to really focus on how we can train individuals in the technology of behavior analysis with, again, a really strong emphasis on compassion and humility, because that's a huge piece of what we do. Anderson Center International 2 we have a partnership with SUNY Empire, as I'm essentially that partnership with the Center for Autism Inclusivity. And I'm super excited to share that we've also received approval to set up a fellowship program with SUNY Empire. So not only will the fellows be able to come and receive really intensive understanding and knowledge of the application of the principles, but also they'll be able to take classes with us and have access to college resources that they may not have had the opportunity to access before. And part of that fellowship will be things like research. And so I'm excited to share too that I'm partnering with my colleague Pooja Panesar in Kenya. She was the first BCBA in Kenya. And we're working on really in a compassionate manner, because I think a huge issue is a Western investigator coming in saying, tell me about autism in your country. We're going to work, that's generally not as effective. So we're working with ambassadors who identify as Eastern African or from an Eastern African country. And we're hoping to be able to really get into contact with people from more rural areas to better understand myths and misconceptions surrounding autism. Two, we're doing things like my colleague in Uganda and I are taking the incredible curriculum that actually has been created by Dr. Peter Gerhardt and Eamon Gravina on sexuality, and Dr. Newman's work on sexuality, and we're adapting it to make it applicable within the Ugandan culture. And I'm just so excited about that, because we have the opportunity to raise the awareness, again, acceptance and understanding of behaviors such as healthy relationships, sexual behaviors that in some countries are sort of considered taboo. But now we're in this incredible place where we can actually provide resources and education to say that it's not a bad thing. And what we need to do is provide education and empowerment for the individuals. And so I'm very excited. My colleague Stephen Kabenge in Uganda oversees the Amanyi Center. We serve children now young adults, adolescents and young adults. And so we're going to be engaging in this really comprehensive curriculum, thanks to Dr. Newman, Dr. Gerhardt, and Amy's work, which it's so hard to purchase things. You know, we're working on a very limited budget, so that is made readily available is incredibly exciting. And those are a few of the things that we're doing pre-COVID, that we were doing pre-COVID, and now we're excited to be doing post-COVID. And it's amazing how telehealth has changed what we can do and how we can do it.
So what do you do in your spare time? Yeah.
SUNY Empire say
I mean, that is just incredible. And again, while you were speaking, there were some things that were running through my mind. And I remember when I first began doing my first international work in the 90s, and just looking at the differences. Again, this was pre-certifications in many places, and now that there are questions about certification, well, it's not. No, we've had to do this before there were certifications. If things are altering, fine. But that doesn't mean that the work doesn't still need to get done. And we still need to get people trained and on the ground and able to work in these places where they may not have had access before, where there may not have been materials before. I mean, it's very exciting now. And again, thinking of COVID and how it's really pushed people having to go to telehealth and everybody having Zoom as a second language kind of thing, or, you know, however many languages you speak. The fact that now distance doesn't mean as much as it did in terms of, you know, they may not have to necessarily fly me there to do a training. I can do a training here, but that doesn't substitute for having somebody on the ground there. and having somebody really properly trained there. So I think that's just wonderful that you have people coming and getting the training who can then go back. And again, it's a very collaborative thing. So it's not necessarily us coming in as the experts from on high, but really working with what's happening there, you know, again, within their culture, and really helping to try to meld and mesh the two. So this is all very exciting. As I understand it, there's also a college component of people who do identify as neurodiverse.
Yes, and thank you for asking about that as well. That is a project I'm so excited about and excited to share with all of you, Bobby, Leanne, because I'm thrilled. So SUNY Empire State College is committed to becoming a college that is supportive of individuals who identify as neurodiverse. I think it's incredibly important that we are not only looking at individuals that identify as neurodiverse, but also individuals that identify with any invisible and or visible disability, because really that's inclusion. And we, you know, SUNY Empire kind of became thrust into the spotlight as it's a small teaching college that's part of the New York State Public Institutions of SUNYs, but they are the only SUNY school that had really been teaching predominantly online, particularly in their graduate programs. And they actually have quite a robust undergrad. We have 80 campuses around the state of New York, but also a really robust online program. And so when COVID hit and colleges and universities were sort of scrambling, it was amazing the way SUNY Empire sort of was able to kind of deliver the message of how to teach online. Now, we know that there's approximately 90 schools in the contiguous United States, according to the College Autism Network, that identify as having specific supports for people who have disclosed the diagnosis of autism. But a lot of those programs, which are wonderful, they are face-to-face. They have a face-to-face in-person requirement. Too many of the programs have a specific pathway that's associated with their program. And so in thinking about how to create a supportive community, and really in keeping in mind equity and inclusion, the thought that we had was, how do we look holistically at a college across all of its campuses, its faculty, staff, and its students to provide universal supports, really so that it's not, a student doesn't necessarily have to feel like I need to disclose and I have to go to this specific program. Instead, this is a college that embraces neurodiversity, again, and diversity with other disabilities. So what we've decided to do is that we are going to be implementing a multi-tiered systems of support framework for faculty, staff, and students. I think it's incredibly important that these changes that we're putting in place, or that the things that we're hoping to do, are sustainable. I don't want to check off a box and say I've delivered a training and everyone's had a training and now we're a supportive college. That's not going to be fruitful for any of us. We really need to change, or we really need to look at the culture of an institution. And I know that many of you here are really well versed in systems change and all that goes along with it, and how tough it can be, but how important it is to lead to culture change and therefore sustainable development. So we are piloting a training this semester with faculty and staff to get their feedback, to gain stakeholder buy-in, to iterate, and then we will be forming an implementation team. And I'm so excited to share that that team will be driven by individuals who identify as neurodiverse, because I'm not an expert. Thank you for having me here, but we know I'm not an expert in autism. You know, you meet one person with autism, right? You've met one person with autism, as we say. And so I think it's incredibly important that we acknowledge the controversy that surrounds applied behavior analysis, and that we engage in behavior change that is driven by individuals who identify as neurodiverse. What can we do to help you, rather than us telling you what you need? I think there's an inherent flaw in the logic there. So this team will be driven by, again, individuals who identify as neurodiverse, and we'll be looking at what are universal supports that we can put in place that are low cost, easy access, again, right, sustainable change for faculty and students, and then what's in tier 2, if you will, what's in tier 3. We're looking at a long-term plan, right, 2 to 5 year. We have a 2 to 5 year agenda that we'll be developing, 5 to 10 years, and so on. But part of this will be for students, a peer mentorship program that we're launching in the fall. There will also be facilitated social skill opportunities, social skill development opportunities. There will be we're working on a workforce readiness curriculum, and we'd like to hire someone who identifies as neurodiverse to help prepare others for job interviews. We want to empower our students. What do you have to disclose? What do you not have to disclose? What are your recourses if any harassment were to occur? You know, we know that we could do an even better job in helping the individuals that we work with, people who identify as neurodiverse, be gainfully employed in areas that they love rather than simply menial jobs. There's a significantly untapped population of students who want to go to college but feel like they don't have the supports. And we're here to try to meet that need. And I'm super excited, you know, in this idea of COVID, because I've had parents reach out and say, you know, my child simply doesn't want to be in person. And individuals who identify as neurodiverse say, I have a really hard time being in person, or I'd like an option. And you're the only school that I found that really does things online. So we hope to offer hybrid, in-person and online supports to meet the needs for all of those, you know, who are interested in going to college. It's very new. We'll make mistakes. We'll iterate on feedback. But I'm really excited because, again, I think that if we approach it in this way, we're going to lead to sustainable changes. And I think that's what we need to see at a college level.
That sounds wonderful. And it sounds like the opportunity for individualization is really there. And I love this idea of people being able to make their own choices. I mean, that's why, again, forgive me, everyone's sick of hearing me talk about it. But I always say, you know, that's what applied behavior analysis is supposed to be about. You know, we hopefully have created some very wonderful technologies for teaching skills. And by teaching skills, we give people a choice. If they have the skill, they have the choice. If they don't have the skill, they don't have the choice. So again, I love the idea of applied behavior analysis providing choice where it wasn't there before, but that still requires us to have the systems in place that will allow for choice making. And sometimes people, meaning well, can make mistakes. As you were saying this morning, I was reading about a situation in Pennsylvania where a farm where some people were living and working, they were being told they can't live and work there anymore because somebody else decided that wasn't good for them. And I got a problem with that. You know, if somebody enjoys farm work and that's what they want to do, somebody else saying that you can't do that because it doesn't fit into our model of how your life should go, I got a problem. I would like to throw it over to Bobby, just in terms of talking about this idea of individualizing and the supports that really are necessary to have in place. You've just helped and worked with so many people over the years as they've been transitioning, and I would just love to get your thoughts on this.
So while you were talking, I was just writing so many things down because you just had so much that I wanted to ask you about. So I almost just want to talk a little bit about this trend that I see with the things that you're doing and get a little bit more understanding of, you know, your personal motivation, because I wonder sometimes if the reason we don't see more of what you're doing, like this inclusivity and reaching out to other countries, is because it almost feels very daunting for people. So when I think of what you're doing, I feel like how do you even begin? Because autism itself is so variable, it looks different on everyone. So how do you then create this inclusive, you know, program that and life and attitude? Even the language is always changing that we use. Like, even if we're just thinking fundamentally at sensitive language, language that demonstrates that inclusivity, it changes very rapidly, actually. And sometimes that even prohibits people from wanting to be a part of having a conversation. So I just look at that one tiny slice of what inclusivity means. And then I think of what you're trying to achieve here. And for me, as a parent, it feels daunting. I did hear some real great things like incorporating these one-on-one interviews with people who can constantly be telling you, okay, this is what you need. This is what's lacking. I heard you talk about how, you're going to make mistakes. That to me says, okay, you're always going to be evolving, because too often we see these programs really great on the, onboarding process and the training process. But then after that, it falls apart a little bit. So I guess what I would want to know is what advice you would have for other people who want to do this, who might just be kind of thinking a lot about like, where do I begin? What do you think is the best thing you can share with them about where to start?
Thanks, Bobby. That's an incredible question. And to be honest, that's one that I think about a lot, because I don't know that there's a perfect right answer to it. And diving into this idea of diversity, equity, inclusion, we know with the deaths of George Floyd and others that it has put into the spotlight again, because this isn't the first time that we're fighting for social justice, but it's brought it into the spotlight again. And a significant worry that I've had is that this will be a popular topic for now, and then something else will happen, and we'll lose sight of it. And that worries me, because I don't think we should ever lose sight of fighting for social justice and inclusivity. But I also think that we're at limited bandwidth, all of us. Even without COVID-19, we all face incredible stressors. And now you're adding a pandemic, we're adding all sorts of things, living in a new normal, in which I don't know that any of us had ever expected to be. And so I believe, and I've had this discussion with others. I'm very open to feedback and thoughts about this, but as the more I delve into this work, I think that we need to remember that, like any behavior change, it we need successive approximations to get there, right? We need gradual changes. And it can be a lot to go from, never having thought about inclusivity to now we need to change everything that we're doing. Because you're not going to, I don't believe one can be successful in that respect. So I think that we consider shaping of behavior, right? One thing I say to my students, and I just want to kind of put this in, if I may, I think it also starts with us as supervisors and professors. We're launching a master's program in applied behavior analysis in the fall. That's our hope, that we launch in the fall. And part of the curriculum that we've developed is compassion. Every class has an objective that focuses on compassion, systems change, and humility. And so I do think that there's a really strong impetus for supervisors, trainers, teachers to lead students and those who are learning in and how to achieve this. So, I think I want to say I do think part of that starts there, but also, for all of us just doing the work, look at your systems, right? And think about how you can make one change right now. And I can't take credit for this. The mayor of Rhinebeck, New York, and Rhinebeck is a town in New York that has so proudly, really worked towards becoming supportive and inclusive of individuals who identify as neurodiverse. And the mayor said, what's one thing that we can do right now to make a change? And when we're feeling tired and we're feeling exhausted, know that if you can make one change, right? Look at one system. Is your hiring process aligned or masked, I should say? Is the scoring rubric for hiring, for the way that you're analyzing test scores, is that equitable? Is there potentially one area in which someone is being advantaged? Start by looking at your internal systems. Think to yourself, like, how can we shape this behavior? Get buy-in, right? Research has generally supported that if you get stakeholder buy-in, that you're going to see more sustainable changes. Particularly, I think game theory and social learning talks about like 20% of buy-in. If you get 20% of the population who's ready to make a change, it's going to start positively affecting others into making that same change, right? So really step by step, think about systems change. Think about, instead of checking off a box, right? I have one person on my panel that's representative of a community that hasn't been represented before I did my job. That's not enough, right? Looking at leadership, looking at the body that makes up, our practitioners. If we're not observing a body that's as diverse, again, let's look at our schooling systems, right? At SUNY Empire, we're trying to make things affordable, asynchronous but robust, so that working families can come into contact with the material, whereas before they had to be at a brick and mortar or they had to be at their desk at a certain time. I know this is a huge answer and I apologize. I think it's multi-layered, but I think really at the core of it is that know that start to set your reinforcement contingencies so that they're smaller, right? It's not just that one huge change, because it'll take time to get there, but think about all the little steps in between. And if you're constantly, okay, I'm going to look at this system today. We're going to have a training in this today, and then we're going to follow it up with this. And let's add an objective here. Let's look at our self-assessment. Do we have something about diversity? Do we have something about humility? All of those pieces will lead to change. And eventually, set your objectives, set your long-term goals, do your strategic planning. And I think for all of us, it would be a great plan to have individuals who identify as neurodiverse as part of our ethics committees, as part of our program development. Say to your therapist, have you asked the family, have you asked the client what they want to do? Make that part of their everyday language. All of those pieces will begin to add up to more sustainable change towards inclusion and towards this person-centered support, putting, in my opinion, the health back in healthcare. So Bobby, I know it was really kind of I apologize again, I think it's a lot of steps, but I hope it started to get to your question.
Yeah, that was awesome. I love that every time you talk about diversity, you follow it up with the word humility. I think that is key. I think that's what we're really hearing in all of the things that you've planned, all the programs and projects you're a part of, is that humility piece, because that just keeps us open-minded. It's, the reason why, you're talking about these other countries, you're borrowing, programs from people like Dr. Newman, but you're adapting them so that they work for other people. All of that, what I'm hearing, I was trying to put my finger on what is this pattern, and it's humility. I think you nailed it when you said, we have to be teaching humility. I think that's entirely the recipe. That I'm so glad you do that.
And I think COVID has actually given us all a dose of that humility. We didn't expect any of this. We certainly didn't expect it to go on this long. And even just things like that, simple, you threw it off as a point, but it really hit me. The asynchronous learning is huge. That means one little thing. And for those who aren't aware, asynchronous meaning you can come on at any time and access the materials, as opposed to having to be in front of your computer at 8:30 a.m. or in a classroom at 8:30 a.m. That is huge. We've spoken about in so many of our other discussions how parents have been put in this impossible role of having to work from home, having to homeschool, in the case of some of our students having to be there to help them through their telehealth as well. There simply aren't enough hours in the day. And even if there were, there's no guarantee that the hour that you have available would be when the materials are available. So even something simple like that asynchronous learning here during the time of COVID has really, again, just made such an enormous difference. And again, not that I'm the kind of person who usually finds the silver lining, but the silver lining here may be this humility that it has forced us to have, and forced us to think of what kind of changes we can make. And by the way, this stuff is working pretty well, so let's keep it once everything else settles back down.
I think that's exactly right. That's exactly right. We can reach so many more people with this telehealth. And again, if we can look at a silver lining from COVID-19, is that it's brought that home so significantly. And I just want to thank and put a plug in for all the incredible registered behavior technicians and frontline therapists and behavior analysts that are in the homes and in the communities, doing this work during this time. And I think we need to really consider giving back to those individuals, right? If we look at our body of registered behavior technicians, they are the most diverse body compared to board certified behavior analysts and so on. And many of them might identify as full-time parents, or they have full-time jobs, and school is expensive. We also know often our frontline therapists are, almost ironically, if I dare say, paid the least, but they're doing so much heavy lifting. So we're hoping that with this program, that it is affordable, that it is robust. We use things like Flipgrid, where I ask a question and they respond to me, and we're face to face, but we're face to face on their own time, so that they are getting FaceTime with a professor, but they don't have to be at a certain place at a certain time. I want to share too, this is something SUNY Empire does, and I walked into it. I cannot take any credit for this, but I was so impressed. They serve, what we might consider non-traditional learners, such as individuals who are working full time. And they do give prior learning credit. So for example, with Anderson Center for Autism, individuals who have gone through their RBT training are eligible for up to 13 credits towards an undergraduate or an associate's degree, which is so significant when we think about cost. We're in conversations, the same conversations with OPWDD, AHRC, and others, because I think, and Bobby, you and I have talked about this. I think it's so important to give back. We as a behavior analytic community need to give back to those who are working the front lines and doing that heavy lifting. And COVID has shown us more than ever that we can do this. Really, we just need to put time and intention and meaningfully create coursework and pathways to bring us there. And so I'm very thankful to all of those frontline workers for their dedication and their time. And we hope to give back to make that career path more easy, and to make learning come more readily.
Yes, I have to echo that. Actually, our last lecture that we filmed, if I'm not lecture, good Bob. Our last discussion that we filmed was with Eric Jacobson and Dr. Mara from up at UCP, and I'm thinking like last month, I think it was, forgive me, a lot of the time comes together, Eric had asked me to participate in a award ceremony for their workers and acknowledgement of their workers. And in typical Eric fashion, we all had to dress up in different costumes and things. He had a nice captain's outfit and what have you. But that's nice. And it was really nice to be able to acknowledge so many of the workers. And I think the best acknowledgement that we can give them is making their path a little easier to help in the career advancement, and helping them to get the necessary supports to achieve everything that they want to achieve in the field and otherwise. So I really have to get behind you there. This is just a tremendous opportunity, I think, to acknowledge people who truly, truly deserve that acknowledgement. And really, if anybody deserves some get back and some consideration, that's the group.
Noor, do you think we're seeing a trend with the field? Because I hear more and more people talk about embedding compassion into everything that we do. Do you see that? Do you think we're headed like in that direction as a field?
I do. I do think so. I could probably, say I'm a little regretful that it took us so long. But let's not look back. And actually, if we do look back at some of the literature, right? There's a great paper that talks about, from the 90s, about self-determination, and yet we haven't really followed up there. So I think we'd started, and I think potentially we might have veered away. Others might disagree. However, our path was, we've gotten here, and I do think that there is a push for compassion and humility. If I can just have us, think even further, when we're thinking about compassion, what are the topographies of compassionate and humble behaviors? I don't think it's enough to assign a reading or to say we have to be compassionate, make sure you're compassionate. Let's walk all of our students and all of those through, again, have you asked the family the priority? Have you asked the individual what they care about? To Bobby's excellent point, if someone enjoys working on a farm, why if there's not a health or safety reason, like why do we need to take it away? Stereotypical behaviors, there's been such a push to reduce stereotypical behaviors to zero levels, but are the behaviors dangerous? I can shake my leg when I talk, I can tap my pen. It's not enough, I think, just to talk about it. And I think that we're realizing that we need to really think about what these behaviors actually look like in practice. They need to, ideally, it has to move from problem solving, sort of a verbal mediation of, did I do that compassionate thing? Did I ask them? It has to become part of our everyday language. It has to be contingency shaped, right? Every single interaction that we have should be compassionate. And we need to think about, what are some areas, how can we teach compassion? Because that's really important. There was a news story that you might have heard, where a 9-year-old was handcuffed and pepper sprayed, because they did not want to get into the car to go somewhere. And I think what we do there is not blame. We talk about how do we embed compassion, right? Think about if that was my child, or if this was someone who identifies from the LGBTQ plus community or the neurodiverse community, how would we feel if they didn't have a voice, and if their rights were taken away? And so I think just taking all of these pieces and starting to think about how this can interact with what we do and how this can shape our behaviors is potentially where we need to go to teach compassion, bringing these examples home and just talking it through without blame. How do we change that system? And I think it starts with compassionate behaviors. And so I do think that we're heading there as a field, and I'm very excited about it.
Well, I think we're coming towards the end of our time that you had allotted. I apologize, or that we all had allotted. This has been really very uplifting, I hope, and it really does give me hope for where we're going as a field. Again, I have been in this field probably about 30 some odd years at this point, from my own beginnings in terms of doing direct care and moving through everything as I've been going through all the different things, from residential housing through schools and preschools and high schools and summer camps and everywhere. There hasn't always been, as you say, the real, I'm going to say, compassionate approach that really should permeate everything that we're doing. And again, I would hope that, if anything, COVID has helped to really be humbling for all of us and be able to take some of the lessons that we've had thrown at us, whether we wanted it or not, and really keep what has been, I think, the good in this, that has really helped us to look at what's essential, what is not essential, and how we really should be approaching the things that that we're doing, and again, clinically and otherwise. And as is always my habit, I'm going to throw it back to Bobby for any of her closing comments on this. But again, Noor, thank you very much for being with us and for sharing.
I think your work has the potential to really move us all forward in such a good and positive way. Everything that you've described, all these projects that you're working on, is really about moving our culture forward, not just our field. And I think that's the piece that makes me feel like this really, I do think this is going to stick. I do think we're going to see this trend continue, because it feels like a whole culture shift, like you were speaking to, where it really comes down to humble behavior, not just training, not just here are your materials, but really being good human beings. And that's really what does it. And I think I am so inspired by what you do, because I really feel like what you're demonstrating and modeling for the field is this compassionate way to move the culture forward. And I love that so much of it is focused on our college population. That's such a great place to really be talking about this with. So thank you for being on today and for, really describing in detail all of the things that you're doing so that other people can hear this and feel less intimidated about trying to do the same thing.
Thank you for your so kind words. They mean a lot, and I appreciate that. And thank you very, very much for having me. It's been such a joy to be here and chat with both of you. So I appreciate it.
Yes, that was really great. I think Dr. Newman and Dr. Syed for having someone at your level recognize our frontline workers, our direct service professionals for having done the heavy lifting during this time, I think is so important. I hope many of those people hear your message because I think we can't say enough for what they've done for our families, for our children. So thank you for recognizing that today. I love the fact that Dr. Syed was talking about sustainability, because it's always great to have ideas, but to make sure that they're going to come to fruition is quite a different thing. And to have that notion of, we know that we have to see it through and keep it going. I think that momentum, your spirit, I could feel your spirit as you spoke. So thank you so much. So I just want to conclude today's COVID conversation with Bobby Rogers and Dr. Bobby Newman. So we want to thank today's guest, Dr. Noor Syed, for joining us. And please make sure to visit our website at specialneedscovid.com to see our other episodes and to read the narratives of families and professionals from during this pandemic. Thanks so much for watching. Stay safe and stay healthy.